I'm sure most of you have heard the terms ADHD at some point in time, but do you honestly know what this is and how serious this disease can be when the symptoms are not managed? I'm going to give you insight on what ADHD actually is, symptoms to watch out for, how much pressure this disease puts on an entire family, and ways to go about managing and diagnosing a child properly. I have full custody of my stepdaughter, who suffers from a very severe case of ADHD among other mental illnesses. A study was done in 2013 by the CDC. 11%, that is 6.4 million children in the United States alone, between the ages of 4 and 17, are diagnosed with ADHD. This number is drastically gone up each year that passes. ADHD, also known as attention deficit disorder, is a behavioral condition that makes focusing on everyday requests almost impossible. They are trying to do studies for concrete evidence on ways to maybe prevent ADHD. Cohen, 2014, states, ADHD is broken down into three categories: inattention, impulse, and hyperactivity. A child, normally with ADHD, will display two or more of these factors for at least 6 months. Examples of inattention are difficulty focusing on one task for a long period of time, quickly bored and cannot finish activities, sloppy mistakes, poor listening skills, and cannot follow instructions. The impulse, they interrupt others often and cannot wait their turn. With the hyperactivity, they fidget their hands and body and feet, they cannot sit still for very long, and they cannot be quiet. Sometimes consulting with more than one doctor may be very helpful when looking for an actual diagnosis, because there are so many disorders that come into play. We need to narrow everything down and find the right diagnosis for your child. My stepdaughter also wears hearing aids. She has a 30% loss of hearing in both ears. So this puts a damper on her communication, because we believe she didn't have the hearing as a young child when she was learning to communicate with others. She suffers from ADHD, ODD, which is opposite defiance disorder, depression, mood disorder, serious conduct problems, and sleep problems. Next, I'm going to explain how much the child and everyone around the child suffers from this disorder. The child's entire life is affected. They have a hard time with school, not only following the rules, but doing their schoolwork and making friends with the other children because they are not on the same level, and maintaining a stable life at home. I can relate to these problems at home. I'm physically and mentally exhausted. I'm always on edge, most of the time depressed. I feel like it puts a damper on my marriage and the relationship we have with the other kids. My other two girls are 4 and 6. They sometimes hate being around their sister because she can be so mean to them and is always getting them in trouble. My 6-year-old is actually acting out and doing things to get her sister in trouble. Finally, I will give you techniques to help manage these symptoms. Once you believe your child or someone you know may have ADHD, it's time to contact a doctor. Stimulants can be prescribed, but need to very closely be monitored with the usage of the medicine. Tokarski, 2012, gives you some tips of how to manage ADHD. The first step is to accept your diagnosis. Practice good self-care, get enough sleep, always take the medicine, stay busy and control your impulses, don't be afraid to ask for help. Think about the consequences and say no if needed. Stay organized, and structure is the key. There is usually other programs besides a counselor out there. These children need structure to stay focused. With funding cuts, especially in our area, we have lost a lot of programs. She went to a nighttime program that was completely cut out, and now she is devastated. We are having a hard time keeping her busy. ADHD is a serious mental illness with the number of diagnosed increasing drastically each year. Some people may be in denial, because I was against the medicine and stuff at first. But now, without the medicine, she cannot handle life. There is a lot of help and support out there for everybody. You just need to reach out and look for the help. Don't be afraid to ask. and take a stand and make a difference in a child's life. Thank you. I hope everybody helps with the child if they can. These children really need somebody to help. Thank you.